Member for Prince George Wilmot.
Well, thank you very much. Good morning, Mr. Speaker. I rise in the House today to speak on an urgent issue facing communities throughout our province. British Columbia, as we all know, is in the middle of a healthcare crisis that continues to get worse. We are seeing an increase in emergency room closures, chronic staffing shortages at UPCCs, and rising wait times at walk-in clinics. There are 1 million people without a family doctor and 1 million people on wait lists to see a specialist. These are urgent issues that are having devastating impacts on the people of BC, and new solutions are needed to relieve the significant strain on our healthcare workers. Currently, it is estimated that approximately 1 million, or 1 in 5 British Columbians, do not have access to a family doctor. Northern BC has a staffing vacancy rate of 20% for their baseline positions, with 55% of hires leaving within 3 years of service. Interior Health has a vacancy rate of 13%, which is an 8% increase since 2019. The average wait time at a BC walk-in clinic has increased significantly in the past year, going from 58 minutes in 2021 to 79 minutes in 2022. The crisis is even more pronounced in Victoria and North Vancouver, which averaged the highest and second highest walk-in clinic wait times in Canada for 2022. Patients right here in Victoria waited for an average 137 minutes per visit, while those in North Vancouver waited for an average of 160 minutes per visit. Conditions have become so concerning that healthcare workers, including leaders from the BC Nurses Union, have been speaking up about how staff shortages and increased pressures have taken a toll on nurses' mental health, leading to high levels of stress, burnout, and concern for the health and safety of their patients. These shortages can be especially hard on rural communities at the heart of this crisis. Communities like Merritt, Clearwater, Chetwynd, Port Hardy, and Port McNeill. In small communities like these, one healthcare professional calling in sick can shut down the only clinic in that community. Last month, Island Health announced the Port Hardy and Cormorant Hospital emergency departments would have to be closed overnight indefinitely due to staffing shortages. According to Island Health data from July 22nd to January 2023, the Port Hardy ER was closed 1,274 hours, 25% of the time, due to staffing shortages. It is clear, Mr. Speaker, that we need all hands on deck so that British Columbians can have the health care they need and deserve. Many physicians and communities, including in Port Hardy, believe there is a solution that can reduce the workload of doctors, allowing them to see more patients and reducing wait times. And that is allowing physician assistants to work in our province. Around the world, and in fact, Mr. Speaker, in many Canadian provinces, PAs play a vital role as members of healthcare teams. PAs help ensure efficiencies and provide patients with access to quality care in doctors' offices, emergency rooms, surgical suites, and cancer centers. Physician assistants could play a critical role in filling in the gaps in British Columbia's crumbling healthcare systems. Yet, current policies in our province exclude PAs from BC's healthcare system. Physician's assistants are advanced practice clinicians who are educated through a 2-year graduate program under the medical school model. They work in a clinical setting under the supervision of a physician, and they can perform a broad range of services, including conducting patient interviews and physical examinations, prescribing most medications, ordering and reading tests, and making referrals under the guidance of a physician. There are currently approximately 1,000 PAs practicing across Canada in New Brunswick, Alberta, Manitoba, and Ontario. And encouragingly, Mr. Speaker, a recent survey conducted by the Canadian Association of Physician Assistants found that 15% of members indicated they want to work in BC. The West Shore, just a few minutes down the road from us, is another region joining Port Hardy in calling for the introduction of PAs as a solution in the healthcare crisis. In the past 2 years, more than 50% of West Shore UPCC physicians have left, forcing the UPCC to frequently close due to staffing shortages. And yet, every morning, Mr. Speaker, there are lines outside the center for walk-in patients. Dr. Charles Sun and Dr. Jane Moran, two West Shore emergency medicine specialists, are advocating for the use of physician assistants at West Shore UPCC. They estimate that hiring 3 PAs could increase the number of patients they can see by 50%, Mr. Speaker, and cut the number of patients without a doctor in Langford and Juan de Fuca to 1,600 from the current 8,000. The doctors of BC have been recommending the introduction of physician assistants to BC's healthcare system. Today, they are joined by a number of other organizations: the Canadian Association of Physician Assistants, the First Nations Health Authority, and the BC Rural Health Network. Mr. Speaker, it is time for us to make sure that we have all hands on deck. It is time to listen to our communities, to our healthcare workers. And Mr. Speaker, this is an action that we could take to reduce wait times, to help where there are staffing shortages in our healthcare clinics. Mr. Speaker, it is a step that would make an immediate difference. And Mr. Speaker, we know that it is time now to allow physician assistants to work in British Columbia.